Hey, what's up, everybody? This is Dr. Craig Kasper with NYHD and the Institute for Hearing and Balance. We're back again with another episode of the Audiologist at Home episodes. This is where we answer some questions that we get in our daily life in our clinic. And we also answer some questions that you guys have been shooting to us at the info@newyorkhearingdoctors.com email address. Today, I've got Dr. Zweig back again. What's up, Dr. Zweig?
Hi, good afternoon today, a little later.
Yes, we did change the schedule a little bit today, but we're gonna get one in every day if we can. So,
Yes.
how's life today? Okay,
Life is good. It's Wednesday.
it
It's
is
almost
Wednesday.
the weekend, which means nothing for us right now, but it's still exciting.
That's true. I try to
Yeah.
keep a calendar, even though it means nothing at this point. So,
Yeah.
in any case, so I have a question for you today, and this was an interesting question that came off the line. And the question is, when do we suspect TMJ disorder might be causing ear pain?
Okay. So before I dive into why it might cause ear pain, let's just dive into what TMJ is,
Okay.
for those in the audience that don't know. So TMJ stands for temporomandibular joint. And the temporomandibular joint, kind of tongue twister there, is the joint that connects the mandible, which is the lower jaw, to the skull. And it's located on both sides of the head, right in front of the ear. So when a patient complains of ear pain, we get a lot of patients coming in complaining of ear pain. The first thing that we do is get a detailed case history, because that's going to give us a lot of information of differentially diagnosing what might potentially be causing that ear pain. Other symptoms they usually report are fullness in the ear, sometimes pressure or clog sensation, intermittent ringing or pain around the ear, sometimes headaches. Research has shown that sometimes people will describe dizziness. I personally don't see that too often when I suspect TMJ, but it is definitely in the research that that might be a symptom as well. So first thing to do is to get a detailed case history. What I'm particularly looking for is, or anything that might be suspecting maybe an ear infection. So we take a look at, is there a history of URI, upper respiratory infection, any viruses? Are there history of ear infections, frequent flying, potentially swimming, sinus issues, anything that might kind of lead us to believe maybe it's an ear infection. After a detailed case history, the visual inspection is really important as well. So we take a look in the ear via otoscopy. We look at the ear canal, make sure there's no abnormality in the ear canal, any drainage, redness, wax. We take a look at the eardrum, make sure we don't see any dullness to the eardrum, potentially redness or suspect any fluid. And then we do the diagnostic hearing test. And the diagnostic hearing test is, a detailed view of the integrity of the auditory system. So is there anything in the ear that's potentially blocking sound? Is there any inner ear disorders, like maybe a sudden hearing loss that might be causing the ear pain? And once we've not usually, but in some cases, we rule out any hearing loss, any abnormalities to the ear, anything unusual that might be leading us to believe it's an ear infection. That's when we start to dive into potentially it being maybe a joint disorder such as TMJ. So we'll ask questions such as, do you clench your jaw? Do you grind your teeth? Do you know of a history of TMJ? And a lot of patients, after, usually noting that there's no ear infection, they will describe some degree of clenching or tightness in the jaw, or maybe stress that might be causing or make us believe that the TMJ joint or the temporomandibular joint is causing some of the ear pain. And then now we have a clear path as to who we're going to refer to next, because we don't diagnose TMJ as audiologists.
Gotcha. So then after that, basically what we're going to do is look at our colleagues who might be either an ENT or
Mhm.
dentists who specialize in TMJ to see and confirm if TMJ might be a contributing factor.
Right. Yeah.
It's interesting because I'm guessing that, especially in times like these where there's a lot of stress, anxiety, the unknown, we're probably seeing people out there who are experiencing more jaw pain or TMJ
Mhm.
related issues because we're probably clenching our jaw more. We're probably grinding our teeth when we're sleeping just because of the underlying psychological components to the stress and anxiety, and then ultimately how they manifest in the physical, which oftentimes can be TMJ disorder.
Yeah.
So awesome. I appreciate that today. Thank you so much for the answer to that question. And if you guys have any other questions for us out there, we're trying to do this on a regular basis. It's info@newyorkhearingdoctors.com. You can always send your questions. We have a couple of interesting ones coming up that we're going to get to. Until then, Dr. Zweig, I appreciate all the information, your insights, and I thank you for all of that today.
My pleasure. See you tomorrow.
All right, we'll talk soon. Take care.
Bye.